Hello there and welcome to the Breakfast Connect show on Africa Business Radio. It's time to get into our guest segment for today, and we're focused on health. We'll be talking about lymphatic filariasis, otherwise known as elephantiasis. Now, this is one of the 15 neglected tropical diseases in Nigeria, and it's estimated about 122 million people in Nigeria are said to be at risk of NTDs. Now, coming from the National Lymphatic Filariasis Elimination Program of the Federal Ministry of Health, they stated that an estimated 138 million people in Nigeria are at risk of lymphatic filariasis. All right. Now, joining me to talk about this is Dr. Chika Nwaejike to give us more insight into, this particular disease or sickness. Hello, Dr. Chika. It's good to have you on the show. Good morning.
Good morning. Thank you so much for having me.
Right, now just a quick introduction now. Dr. Chika Nwaejike is a medical doctor who works with the Babcock University Teaching Hospital. He has special interest in persons with special needs and how their peculiarities can be catered for and their individual contribution to society better harnessed. Dr. Chika, when you say you cater for people with special needs, what exactly are these needs?
Okay, I'd say that I would, if there were specialties, mine would be people with hearing impairment.
Okay.
Because I have had a few friends, a few acquaintances who have hearing impairment, and these guys are so amazing, so intelligent, given the right, the right environment. I have a friend who has a master's and he's deaf. He's going for House of Assembly,
right,
and he's deaf.
Interesting.
And, yes, I must say, I've heard of a lawyer that is deaf. There are a lot of deaf people, and the things they can do are just like what you and I can do. And it's not as if they don't have a language. It's actually just that we cannot speak their language. And so one way to empower them will be to help them to be able to speak their language. Once a deaf person can speak his language, I don't believe he's handicapped anymore.
Right. Okay, nice one. So let's get into the conversation for today. Elephantiasis, right? It's not very common, I must say. It's not like malaria or typhoid that we hear once in a while. But for the sake of those who do not know about this disease, can you shed more light on it?
Well, elephantiasis, like you said, it's actually filariasis. Elephantiasis is the name given to it because of its presentation. It looks like the person's leg is becoming an elephant's leg, But then it's more of, I'll explain it this way. Sorry if you're not Christian, but I think this is a good way. When Jesus was on the cross, they said he had, when they pierced him, they said water and blood flowed. Remember the Bible? And so that water that flowed is actually lymph from a system of a connective system in the body, the circulatory system that is called lymphatic system. So it takes what we call lymph, around the body, helps with fighting of any organisms or anything, all these diseases and things, So that lymphatic system can get blocked. So when it gets blocked, it produces the enlargement of the body parts that you see in elephantiasis. Okay, so what blocks it mostly, especially when it's infectious, is filaria worms. These are worms. They are not like other microorganisms that are very, very tiny. These ones are tiny, yes, but they have enough mass to be able to block these things. So when they block them, lymph that could go back to the body cannot go anywhere. So it just stays there, and that's a part of the body that begins to swell. Now, people know that there's elephantiasis on the leg, on the lower limbs, on the legs, but we know that there is also elephantiasis on the hands. There's also on the breast. There's also on the scrotum. There's also on the vulva. Okay, so what is public knowledge is the one for the leg, but a lot of people have these things, and it doesn't show. So people don't know that people have it.
I think instances where I've seen this elephantiasis case, most times on the street, you see people parade certain people with this disease and seeking for aid, and it really doesn't look so good. And the fact is, elephantiasis is not the only NTD. We have about 15 of them. according to the research that I made. And I mentioned earlier that 122 million people in Nigeria are said to be at risk of NTDs. What is the cause of this disease? Why has more awareness not been created on NTDs?
Yeah, NTDs are not fatal. Okay. One can live with elephantiasis and not die. Okay, it's not like malaria that can kill somebody in 2 minutes. NTDs take a very long time before they can start causing havoc. Even before they can start causing the embarrassing things they cause.
Before they begin to manifest, is that what you mean?
Yes, before they begin to manifest, they can take such time. And even when they manifest, their manifestations are not, necessarily life-threatening, as it were.
But it looks really burdensome. When you see them, it doesn't look like something you want to carry around for even 1 hour. So is that why there's no awareness to it?
People are not dying. Yeah, because the people are not dying. Okay, and because the it's not the infectivity of those diseases. That's just the way it is. So it can avoid someone that is in the upper class. They can easily, avoid them.
So since it's not transmissible, it's fine.
It is transmissible, but it's not as transmissible as malaria and the other things. I mean, if you wear good shoes and stay in a neat environment and drink potable water, you hardly get any of these diseases. You understand? But if it were like malaria that can bite your gate man and come and bite you, I mean, the big man will get worried about malaria. So it's basically because of the class that is mostly affected.
Right. So I watched this documentary some time ago on elephantiasis, and one thing that caught my attention is that it takes 15 years. As you've mentioned, it takes a very long time. 15 years to start to, show the symptoms for it to be, out there. So what are the little symptoms at least? Because I just need something we can point at and say, okay, if you're feeling this way, if you're feeling that way, then you might need to run for a checkup. It doesn't matter if it's 15 years to come. I mean, we all have some sort of malaria in our bodies, even though we don't feel or fall sick. So I'd like to know, those symptoms you should look out for, even if it's as long as 15 years, really. Yes,
okay. Let's start from the fact that the early symptoms are non-specific.
Okay.
Things like fever, things like cough, those things are non-specific. Especially given the fact that the cough is not productive. So you're not feeling like there is putting, I need to see the doctor, something is, in my throat or something. Is dry, and it doesn't happen in the daytime. It may only disturb your sleep just a little bit. Okay, so the early symptoms are not troublesome. I guess that's why many people don't notice it. These symptoms are like fever, and then one thing that can give it away is if there is like a scaling. Sometimes there will be like a scaling of the skin.
Okay,
and yes, like an exfoliation of the skin. Then. So then sometimes there may be other. Yes, the skin can help us a lot because there can be a lot of things. It could be that it could. There are a lot of ways. It could manifest on the skin. There can be edema, there can be itching, there can be redness. There can be things that may look like rashes.
Yeah.
Okay, on the skin. Then the color of the skin may change. Okay. Then these filarial worms, there's something interesting about these worms. When they are under your skin, you most likely will see something moving in your skin.
Oh.
You will see. Yeah, most times you may see something physically moving inside your skin. Okay, so that will be it. It can also affect the eyes. When these worms migrate, they move around. Okay, so when they get to the eyes, the person will feel some itch until they walk past. Just like someone that's strolling. This thing just stroll around like that. Yeah. So and okay, I actually sorry to take it back. The other question, why talking about this? That one of the etiologies of it is actually known as the Calabar swelling. Worldwide, it's not Calabar swelling. But that will tell you, why these things are really neglected. They do not really affect the class of people who really want to have the money to. Whatever disease you see that everybody knows about was publicized by somebody.
Yeah.
Okay. People have HIV. A lot of people have HIV. Yes. But I'm saying that it's not as if it's on the face. But if they didn't tell you a lot about it, you wouldn't be as scared of it.
True.
As you. Sometimes the skin also can get ulcerated back to the skin, and then the person will feel swellings. The person will feel swelling in the armpit and in the groins. Okay, these swellings. Okay, for the layperson in the groin, between the lap and the private parts and the weapon of mass destruction, there could be this swelling. So these are telltale signs. Yeah.
Okay. So elephantiasis is not fatal, and it has its symptoms, but it takes a long time. Yes, it takes a long time to manifest. But with all of this, is there a cure for elephantiasis?
That's a nice question, guys. A cure. There's a way you can kill the filarial worms. Okay, go to when you're tested. There are ways to test, and then they will kill them. But to reduce the swellings, to reduce the sequelae, you can't really that whatever part of the body that was may not come back to normal again.
Wow.
Yes, because the deed, this whole thing said the deed has been done kind of thing.
Yeah.
The place was blocked. Then because of the blocking, it has ballooned out almost all the structures there. So those structures are big, whether you remove anything, like people that, all these people that are very fat, and when they now begin to exercise, you see that they now have flaps. That kind of, so now look at the inside of the body. That's how it is. So it's not easy, even cosmetically. With surgery and all, it's not that easy.
I think this is the more reason why emphasis should be laid on preventive measures, because obviously you cannot overturn all of the manifestations of elephantiasis, which is why more emphasis should be laid on preventing this disease. This is why this conversation is very relevant. We need to know what we should not do, or how we should prevent this from happening in the first place. I'm not sure I asked you that question about preventive measures now.
Preventive measures. Preventive measures, yes, there are preventive measures. One good thing to say is once I see a nodule, once there is something I can feel in my armpit, and it's good from time to time to feel my armpit. Okay, once I feel a nodule in my armpit, feel my groin. Okay, once I feel a nodule near my testes, that's, it's as if I'm moving another ball, or a lady, you're feeling something around your vulva that's looking like, please, it's important that we just show it to a doctor. What could this be? Sometimes it may not be scary, sometimes it may be worrisome. Okay, when the doctor sees, the doctor will now make the decision. Okay, and then it's also important to be clear. Most of these, did I tell you that most of these filarial worms are also somehow transported or transmitted by mosquitoes somehow?
Really?
Yes. There's not only the Anopheles mosquito, there are other mosquitoes. That's why I was telling you that staying in an urban area, could actually be enough to, because in the urban area it's mostly the Anopheles we see, but inside those bushes where there are certain flies, all those things, you don't know what has not, so so it's good when one is in a place where the person is not used to, especially if it's rural, to wear long clothing, and then just try to use mosquito nets. Basically the same way I'll ask you to use to prevent
malaria.
Yes, it's the same, basically the same way that I would ask you to use for prevention of this disease. Sorry about that.
Right. All right, Dr. Chika, I think we should move over to something else now on a lighter note, of course. You are a medical doctor and you own a fashion brand, ChiQlin Wearables. Did I pronounce that correctly? ChiQlin Wearables. How have you been able to marry both? How are you a doctor and a fashion designer?
Well, the labor market in Nigeria has given us that occasion.
Okay.
I don't know if there's any. I don't know how many people are being paid fully for what they do in Nigeria. Okay. The life some of us want to live is not a life like I don't really want to travel out of the country. I really want to make impact here.
Okay.
So I think, since the hospital may not really give me all I want, I just thought of something else to do, and God gave me that.
Right.
And then we're also we're also looking to, I'm still, I've not here. This is just something we're thinking of. We're looking to start to turn the brand into a social, enterprise where we will use the brand to train deaf people. It will get to a time, I must tell you that if you walk into my company, 90% of people inside there will be deaf.
Right.
That's basically what happened. Yeah, so ChiQlin is not just going to be a fashion brand, to do many other things so that we can accommodate as many deaf people as we can. So the company that's what we are thinking.
Amazing stuff. Amazing stuff. I love how you focus on people with special needs, and you still have plans for them. I was just going to say, a medical doctor maybe wanting a side hustle could want to go into maybe skincare, or something just related to health or something like that, but you moved all the way to fashion. But then again, I can still see the link when you mentioned that, I still want to employ people with special needs. So I really love that one. Thank you so much. You are doing amazing stuff, Dr. Chika. And thank you for making it here on the show. It's been an amazing conversation with you. I hope that you'll be available for further conversations around this too.
Why not? Thank you so much.
All right. Have a nice day. I have been talking with Dr. Chika Solomon Nwaejike. He is a medical doctor. He works with Babcock University Teaching Hospital. He has special interest in persons with special needs and how their peculiarities can be catered for and their individual contribution to society better harnessed. Thank you once again, Dr. Chika. It's still the Breakfast Connection on Africa Business Radio. I'll be right back with more. Stay here.